Okay, I just want to welcome everyone to today's webinar, which is we're talking about loss in the LGBTQ community. And I will first just introduce myself. I'm Kylie Hanish. I'm the founder of Return to Zero Hope, which is a nonprofit organization focusing on providing holistic support to people who have experienced losses during their journey to parenthood, which encompasses all sorts of losses. But I'm hoping that you've been through to our website and found us that way. But if you haven't, you should take a look at that. There's a lot of great information on there. I myself am a bereaved mother, and I started this organization to support families, but also to educate providers on how to better support families, right? To create confidence in doing that. So a lot of you here are providers, which is really awesome. Thank you for being here. I'm going to start off by introducing Amy and Shelley. And so I met Amy and Shelley in different ways. Amy came to one of our support groups with her wife, Adrian, after they lost their son, Sebastian. 2020, is that correct? Okay, so I lose track of time during COVID. I have no idea what month or year it is. And so that's how I met Amy. Shelley, I met as I was forming an advisory committee for loss in the LGBTQ community. So she came to us a different way. So I'm going to introduce the both of them to you, and then today's just going to be an in-depth conversation with the two of them, and we can use the chat feature to ask questions as we're going along, and just kind of like dig deep into some of these issues of what having a baby is like and all the different types of losses that can occur for couples, parents, as they try to have a baby. So first, I will introduce Shelley, and Shelley is a licensed clinical social worker, and she understands that creating a safe and therapeutic atmosphere is essential for families to learn and support each other, especially through times of crisis. And as part of the LGBTQ community, she recognizes the challenges of efforts to create one's own family and the many layers of loss that come from this. And she hopes to open the lid to explore these difficult topics with open, honest, and compassionate conversation. So she's really willing to be here and be vulnerable with us. So Shelley, thank you for being here. Amy, I didn't say Shelley. Shelley's last name is Perlin, and Amy Gusick. So Amy's an advocate for providing support both for the fertility journey and pregnancy and infant loss within the LGBTQ community. Her and her wife experienced a preterm labor and birth of their son, Sebastian, at 25 weeks, and he died shortly after his birth. And so they were referred to RTC Hope by another provider. And through this journey, Amy's become an advocate for pregnancy and infant loss support targeted toward the LGBTQ community. And so Amy and Shelley both were on this advisory committee that we created. And because Amy had been through the support group and Shelley's a therapist, and they were engaged with the advisory committee, I asked them if they would lead a support group for LGBTQ parents who've experienced losses of any kind on the journey to parenthood. And so they, as part of this kind of initiative in educating people about this experience, we're doing this webinar, and then we will be offering support groups in the future. And so I'm just excited to be here. There's probably going to be a second one of these webinars because we couldn't cover everything we wanted to cover in the first one, because there's a lot to talk about. So I'm just excited that we can present this information and we can open the open the conversation, right, to talk about the things that are happening but aren't necessarily being talked about, especially in public ways. So Amy and Shelley, thank you for being here. That was a little bit of a fumbled introduction, and I apologize. I'm a little bit scattered by like the environment here. But I'm gonna let you both are gonna talk a little bit about your stories, how you came to Return to Zero, and you met us and met each other.
Sure. Yeah. Thank you so much for the introduction. I can go ahead and start. So, well, first of all, Shelley and I just wanted to thank everybody for being here, certainly. And also, we wanted to mention that, you know, throughout this conversation that we're going to have today, it's obviously LGBTQ plus specific, and there are lots of different ways for family building within the LGBTQ plus community. You know, I mean, I can't even really name them all. There's a lot of different kinds of situations. And I think that today we're both going to be speaking from kind of our situations, but want to recognize that there are many other types of journeys, other family journeys within the community that may not necessarily be touched on today, but some of the things we will talk about in terms of different types of systemic discrimination, health, you know, those types of issues likely are kind of cross over many of these other kind of family building journeys. So we just want to make sure we're not, make that clear up front, we're not being exclusive. For instance, you know, our experiences have not been in terms of adoption or loss during adoption or anything like that. So that won't be covering that today. So I, as Kylie mentioned, my wife and I, we lost our son at 25 weeks. He was born, I held him while he passed. So, you know, after going through that experience, we had been trying to get pregnant in, you know, some way or another, kind of stops and starts over about a 5-year period. So for it to kind of culminate in something that was as traumatic as that, we also had a 5-day stay in the hospital before that. So there was a lot of medical trauma. There was the death of our son, and just kind of dealing with the deaths that, you know, all of the losses that kind of occur throughout the journey that we had is something that we wanted to recognize as well. And that all kind of culminating into knowing that we needed to reach out and knowing that we needed, really wanted to help, really needed help. And we were directed towards Kylie and her organization, which was absolutely wonderful. Went to a group with them. And I loved the group. Everybody was so nice. we still keep in touch with some of the other bereaved parents that are in the group. But one thing I did notice as a non-gestational mother is that, you know, there was no one else in the group that kind of had a baseline understanding of where kind of I was coming from as a non-gestational mother. And I think also that, you know, would have been true too for kind of understanding what the process is like for someone within the LGBTQ community and the varied family building processes. You know, there was no one else that was in the community in that group. And, you know, it was a wonderful group, very, very helpful. I really credit it with helping us so much right in the beginning. But recognizing that it would be nice to have a group that is specific to the LGBTQ community. So that's kind of how we started these discussions. And what Shelley and I have been kind of working through over the past, you know, number of months we've been working with Kylie. So Shelley, do you want to?
Yeah, sure. Thank you. And thank you, Kylie. And I'm still honored to be part of this journey and really excited to be doing this webinar. So I came to Return to Zero in kind of a little bit of a roundabout way. So my wife and I have been and continue to go through fertility treatments for some years now, about 4 years at this point. Through that journey, we'd had multiple losses, but kind of if you want to use the adage, the straw that broke the camel's back, the thing that was really challenging was doing an egg transfer that ended up with kind of things starting and then just completely not continuing. And at that point, for me, I recognized that I was really struggling. As Kylie had mentioned, I do work in mental health, but I do not work in perinatal mental health. And it's very, very different and very specified. So I recognize my own need for more support. And I happen to have a colleague, which I'm kind of glad this happened this way, that sent me an email from Return to Zero, and the rest is history. You know, got involved, then ended up being part of this and ended up participating in a group. And one thing that really sticks out to me is when Amy and I first met and just started talking about kind of why we even were interested in running this. We had these similarities that we could just very easily like, oh my gosh, this just happened. And even if our actual experience was totally different, we could very easily understand the other person's experience just by like, oh my gosh, I remember when someone said this to me and it was just so insensitive. And it was almost like this light of like, oh, we can talk about this and kind of know what we're talking about. And specifically being part of the LGBTQ community, and furthermore, recognizing the place we are, which Amy and I both happen to be at this point, non-gestational carriers, for our losses, there was some connection we had, not even knowing each other, not even knowing anything about each other. So that was really powerful. And I did participate in a group and it was wonderful in so many ways, but I definitely saw the need for an LGBTQ plus specific family building group. And I saw how that could be so beneficial and so helpful, and just have a space that felt comfortable. So Amy and I kind of came with the same thoughts, although from really different experiences. So coming in and having this experience, it was really, it was touching in a lot of ways, but also really enlightening to say, oh, we can actually make this, because we couldn't find it. I'm actually on the East Coast, so go East Coast. I'm over in Baltimore and Maryland. And so finding Return to Zero was great, although I kind of landed on it. It was a great option for me, and being able to do things remote is really nice too, because we can still stay connected even with time differences, which I see many people from different places. So, which is very awesome.
Thank you both. Yeah. So I think we're going to start out by just talking about some of the issues facing LGBTQ plus parents on their journey to parenthood. I can name some, but it's like, we can start with access, discrimination. I don't know. Where do you guys want to start with that?
Well, I can start. I think something to understand about, there are a number of issues facing the LGBTQ community on the kind of journey to build a family, or to expand a family. I think that, one of the big things to understand about it, and Shelley alluded to this a little bit, is kind of having this baseline understanding of the types of things that, do impact LGBTQ community on a daily basis, and having those kinds of things that you carry with you on a daily basis, and then having to jump into this whole other world, which is really not necessarily designed around, couples from the LGBTQ community. I mean, even things as simple as having, mother, father on all things, healthcare. It's sometimes it's not an out and out discrimination, or a discrimination that was very purposeful. It's just the way that the system is set up. And so that's kind of one of the things that's great about having a space that's specific for this community, is that you already have an understanding of what that is. So then you understand that, some things that occur in the family building journey, whether it's failed IUIs or difficulty finding egg or sperm donors or whatever it may be, you can understand that that is just yet one more thing that makes it that much harder to kind of combat against. And so, that kind of systemic discrimination is seen not only within society, but also definitely within the healthcare system. And I think that, and you can talk about, for instance, insurance. I had zero insurance for fertility, absolutely none. So everything that we did that had something to do with fertility, we had to pay for every single thing out of pocket. And that's not always the case. Certainly it varies wildly, but that's something that's difficult. So that those financial costs are just one more thing to remind you that it's that much more difficult for you to kind of, be able to build, to kind of expand your family. And Shelley, are there things that you wanted to touch on in terms of that?
Yeah, for sure. I am fortunate where I do have insurance coverage. That does not mean that everything's covered, but it does mean there's certainly a benefit of having some parts covered, even financially, and just you don't go into building a family saying like, okay, I need to have this many dollars to just even get to the point of possibly having a pregnancy, no matter who's carrying. But it's something you really do have to think about and plan for. And while there are lots of options, one thing that has become more clear to me over time is that when you're looking at the process of infertility, the fact of bringing any donor sperm, donor egg, you automatically go through a very different path than if you're coming and able to provide those things from the partners who are available or the person who is available. So as soon as there's donor involved, it just changes everything. And the insurance coverage, going back to what you're talking about, Amy, the insurance coverage is very, very different. And there are so many barriers. I mean, I was straight up denied IVF because of donor situations and just all these issues that came up that weren't expected, but then very much make you feel even more isolated. And going back to what Amy was talking about, having this happen so many times, we can even look at them as microaggressions that just keep coming up and coming up and coming up. And then you get to a point where you're just like, when am I going to catch a break? Like, the system is set up in a lot of ways that it fails us. I also think about kind of the access we have. I feel fortunate that I am around a very large city that there is access to different options, but I want to also be very clear about access regarding your medical provider. I had a situation where I ended up switching doctors. I did not have a choice to go somewhere else because my insurance covered one place. And so that was my only option. But switching providers, because while my wife and I are there, the experience was not positive, and I was not in the room. It was being talked about with my wife while I was the patient. So we have actually both been patients in different places. And those kind of experiences are very challenging and very hurtful. And you're already so vulnerable just to step in a room to talk about planning your family.
Yeah, and I'm looking at the questions, and someone had a question about how do we change language that's inclusive of LGBTQ and cisgender, where both are respected and need to feel discriminated. And that's a really good question. And I think from my experience, to give you an example, after our son died, he was born, so we had a birth certificate for him. And in the paperwork we were filling out for his birth certificate, it said mother and father. And so there was no, since my wife and I were both mothers, there was no place for me to put, because we understood what they meant, to put what I was. And after going through something where I had just held my son while he died, it was really, really difficult, I have to say, where to yet again cross that out and write in parent. So I don't know why, it seems like there are other options. Certainly parent is a good one, and I don't mean to say this in terms of we should never use those terms mother or father. I mean, that's certainly not the case at all. But I do think in some sort of, healthcare situation, or particularly in a situation like that, there should be some kind of forethought about how, you can be as inclusive as possible for individuals, or even for, situations where there are other individuals involved, whether donors of some sort. I mean, there should, having that, it's a small thing, I'm sure it's a lot to kind of change all this language on paperwork, but that was really hard. And I'm very used to that, having to cross out father or something like that, on that. And, the woman that was taking her information, it seemed like it was the first time she had ever worked with a same-sex couple having a baby. She was kind of asking, well, how do I fill out the birth certificate? And I'm thinking, like, I've literally just had the worst day of my life, and you're asking me how to do your job. So I think that there's like a level of training that needs to happen in terms of that as well. And it's if it's first people's time, dealing with that, that's fine. It's totally understandable. It's just not the time to ask me how to deal with that. So I think something like that, just having kind of more gender neutral language on things would be quite helpful.
Yeah, I'll say, in terms of in my, work life, working in mental health, just don't assume anything. There's no need to assume, just ask. We don't know anything about anyone we're walking by in the street. If someone's coming into a hospital, you know anything about them, just ask them. No, there's no offense taken to be like, and who is this? Something that simple. And who's here with you? So that you can be clear, and then making sure that everyone then knows. So as the staff, having that communication is also really important, because certainly in a hospital, staff change, and knowing who is important, because that's not something you want to keep repeating or being mislabeled, because that's painful.
Yeah. Yeah, I was, as I was in the operating room with my wife, and she had had a C-section, and my son had died. They were, stitching my wife up. The doctor, not my doctor, a doctor that was there assisting, looked over and said, "Oh, are you her sister?" I was like, wow, like, really? So I just like training, I think is really beneficial in terms of those kinds of things. So those are just, I think, maybe some kinds of examples from our experience on, I mean, some of them are relatively extreme examples, I realize, but just on our experience of, these things that, and some of these are going to be consistent for, heterosexual couples, certainly insurance issues in terms of fertility. I mean, all those kinds of things, those are, we're not the only community that deals with this by any means at all. But, like other minority communities that do have systemic discrimination within society, we feel the impacts of those things just that much more, I think, in some cases, and areas you wouldn't really expect it. And this also, something that we, neither one of us have experience with this, but, certainly thinking about health concerns for transgender and gender nonconforming families is something that I think the healthcare system has not caught up with at all. And that's another large, minority population, even within the LGBTQ community. So that's something I think to be kind of cognizant of as well.
Yeah, those are great points. Yeah, it's just, don't assume. I don't mean to oversimplify something that's not simple, but just don't assume things. It's just so much easier to ask and just more respectful to people. And also one thing that I was thinking about when you were talking about that was also in terms of your plans. What people's plans are for their families are so unique. And this is not specific to LGBTQ plus families. It's anyone coming in, just finding out what people's plans are, what they would like to do, what they would like results to be if they could wave their magic wand. It's something I think about a lot in terms of fertility, how many times it's asked and clarified and asked again. And I kind of just wish I could like get a folder, put my name on it and say, this is what we'd like. Please refer to folder every time you want to ask. Because it is asked a lot of times, or at least that's been my experience. I get asked, anytime I'm in a fertility appointment, it feels like I get asked about that. What's your plan? What's your plan? And I'm like, same from 4 years ago, hasn't changed. And I know, again, I'm still on my journey, and, many people's journeys are longer, some are shorter, but I have heard, again, anecdotally, so I don't have any research on this, but most people going to fertility think it'll take about a year. And I remember Amy and I having this discussion being like, right. You kind of think like you'll get a little help and then it'll move on, and recognizing the pain and the losses that happen when each time you think it'll happen. And you're thinking, okay, they say the average amount of time someone tries is 4 to 7 times. It's a huge gap. But what does that even mean? Does that mean 4 to 7 times as a family, a person? What does that mean? So it's really hard when you fall out of that. And you don't make those numbers, or the results are not what you intended, or you find out there's a genetic complication within you. I'm talking even pre-pregnancy. I'm speaking even just genetic testing through fertility. If you do that, there's just so many parts that are so painful. Just be aware of that.
Yeah, and I think too, and I think this would be consistent for, heterosexual couples that are going through fertility as well, is the idea that, every time something doesn't work in IUI and IVF, whatever it may be, I feel like there's this tendency of people to say, oh, you can just try again. And it's like, well, yeah, sure, there are instances where maybe it is easy to try again, but there's a lot of times that it's not, so and I think that that's something that was always quite frustrating to me, this idea like, oh, you can just try again. It's like, well, you literally have no idea how much we had to pay and go through, and all the emotional support we needed to kind of get where we are. But I think that also speaks to, in some ways, this is something I've thought about quite a lot in terms of fertility journeys, which is pretty consistent for most LGBTQ people in the LGBTQ plus community, is that just nothing is private. If you're a couple that, you can have a baby together in terms of your biology, you can be trying to have a baby for years and maybe no one would even know about it, but in our community, I mean, most people know, there's doctors, you're probably, there's going to be all sorts of situations, and it's not a pleasant process. It's not a fun process, as Ideally it would be, but it's not. And so that's something that I think is, it's a very stressful process, the whole thing, very stressful. And it really drains you. It can drain you financially, and I think it can drain you emotionally as well, physically, you know.
Yeah, for sure. I remember, just want to make one more point. Sorry. I remember when I first came to Return to Zero, and one of the things that that was started off in the group, which I know Kyle, you guys work really hard on, is to identify that labeling loss, that don't label loss. It's loss is your experience, and that's your experience alone. And that's not that you're alone, but that if you feel it, it's a loss, that's what it is. And I have found that to be one of the most therapeutic things that's been said to me. Because it's very hard to be identified as having loss when you're not, one, you're not the person, you're not pregnant. So there's not something obvious to say, oh, they were pregnant, or if people don't know the details, which many people don't, because as Amy said, so much is not private, that there are certain things that you then keep private because it's just between you and your partner. And that's the only kind of intimate kind of conversations you can have that is just between you. You both, and not like, you know, all the doctors involved in it becoming so medical that it's not so enjoyable. It's more like, okay, we need to do X, we need to do Y, we need to do Z, and here we go. So it takes a lot of the kind of excitement out of it, because while you're still wanting it to happen, obviously going through all this, as Amy said, the emotional toll, the physical toll, the financial toll are all a lot. But that's something that I wish I was told way earlier on.
Can I go back and ask you both about, because there's so much I want to say, but I want to ask you about identifying who's going to be the gestational carrier. Like, why don't you, if you're open to like sharing, like what goes into this decision? What was it like in your experience? How, like, you both, I mean, yeah, you both in some of your situations were not non-gestational carriers, but have you tried, like, how, yeah, let's talk about that process.
Sure. Yeah, mine's probably a little bit less complex than Shelley's, I think. So I'll go first, and then so my wife and I'm older than my wife by a few years, and we didn't together kind of later in our 30s. So I actually tried, I did a few IUIs before we moved on to my wife, but I never really had I have always had a desire to have children, but I've never really had a huge desire to actually birth a child. So whereas my wife had, but I think this is a really good question, because these questions do come up. And in our case, we kind of knew, okay, well, we're just, going to focus on my wife. But then thinking about the sperm donor was something that we had to kind of discuss too. And I know that choosing donors can be, a difficult decision for, do you do unknown? Do you do known? Like, how do you do it? I mean, there's all those questions too. So Shelley, you can.
Yeah, I mean, I think this can also be its own webinar, but I will try to be brief. So I was the kind of the opposite of what Amy just said. I was the kind of person where when I was a little kid, the only thing I wanted in life was to have kids. So that's been a desire my entire life and continues to be a desire. My wife is also older than me. So there was actually, like, strategy wise, it was like, okay, you go first. So my wife did, and she did IUIs and IVF. And unfortunately, none of them, there were multiple tries, and we didn't result as we wanted with a pregnancy. And so then it was my turn. We actually ran out of money on her end, like her insurance, that was all they would cover, which unfortunately became the factor, because that doesn't feel good to say, but it's the reality. And then on my end, I was able to do 2 IUIs, and I've done 2 rounds of IVF, and we do have embryos. And that is exciting and frightening. And so in terms of what's going to happen, I definitely am open and interested in being pregnant and in having children. My joke always is that my partner wants 1 child and I want 10, so we'll be somewhere in between. But yeah, as Amy brought up, in terms of donors, that was something that we had to sit down and really talk through and explore and see what our options were. And we ended up landing on a donor. And then when it wasn't working so many times, we actually started to, let's make clear, I started to question, is this really is this a good option? So there's many parts in which science seems like, wow, there are amazing things we can do. And there are, and I'm not going to diminish that, but they can't do everything. So it's very hard when you think like, this is amazing. You can like have these embryos and they can be there. But like, that's what happened with us is we did the first embryo and it didn't happen and there was nothing wrong. To this day, they cannot tell us why it happened. And we've asked the question over and over again. And so that was really painful. And while it was at that stage, the actual thing was called an embryo, for us, that was a baby. And so we lost that baby and we've lost the other 7 babies we tried to have. So it was a lot of loss going on at that time. I will happily share, I no problem with this, is that we are currently pregnant, which is exciting and frightening. And that's something also that you don't learn about. And I will give you credit, Kylie, for saying to me, yeah, the innocence of a pregnancy is taken away. And that's something else I think is so important to think about. It's exciting and it's so scary all the time. And I think that people see or hear about a pregnancy and they think that's awesome. Oh God, so exciting. Oh yeah, you'll be fine. I can't tell you how many times we've heard that. And when I hear it, I actually stop breathing now. I'm like, don't say that. No, you don't know. You have no idea. It's very scary. And that's the feeling I would say that I feel most of the time.
Thanks for sharing, both of you. Okay, so I think that moves nicely into just talking about the multiple types of losses that can happen on the fertility journey. Just a little, I mean, you both have alluded to a lot of them, but just maybe kind of going through what those could be, because I think it is our natural tendency to think, okay, there's the loss, you know, like it has to be a miscarriage or a stillbirth or an infant death. But what I've learned from you both is that there's so many other losses that can happen. So let's talk about that just for a little bit.
Sure, I'm happy to take it. Yeah. You know, there's so many steps to take, and maybe in a very logical way. You can kind of hear the general, this is what's going to happen. Again, if you're going the fertility route. So I'm just going to be very clear that I'm speaking from that route. Although I think in an adoption route, it's somewhat similar in the sense that you get a general information, but then there's many steps in between. So I think of the fact of kind of knowing what the end result wants to be and knowing where we're starting, but not knowing how many steps it is to get there. And so basically, you know, you start off with whatever the first thing is. Usually there's tracing of blood and there's tracing of hormone levels, and there's seeing how everything's working within your body before things start regarding any medication. And there's many, many times, at least the experience I had, which is wonderful, is we were very actively involved and have been, continue to be actively involved in every choice. But I'll be honest, one of the most important things is having that doctor with you that you trust. And we found an incredible doctor that I cannot sing the praises of enough. And we're able to ask advice when we need it. What do you think about this? What's your thought? What does that mean? What's this? What comes up, and sorry, Kylie, I'm going to diverge for 1 second, is the fact that statistics are very kind of encouraging and really upsetting to hear. Right? The statistic of where you are can be really exciting. Like everything looks great and that's really exciting. It can also go the exact opposite way when it's like, well, the chances of this occurring or the chances of this happening are this little. So to me, it's more about the steps kind of, and then what your body does, which you don't have control over. And then is science at a place to address it or not? Sometimes I think things are identified and then you might know, for example, if something has to happen because your body doesn't produce enough of a hormone, or your body produces too much of a hormone and you have to be watched for that reason. So for me, when it came to losses, it was kind of every time we tried, for example, like an IUI, which was super exciting. And, you know, we would be very over the top cautious is what I would call it, although I'm not judging it, in the sense that like we would take off work the whole day, like you stay home, you just rest, you don't do anything else, you eat healthy foods, like really trying to follow everything to a T. Like every step, and then going in for a blood test and finding out, well, it didn't work, and really wanting to know why. And so that in itself would be a loss. It was also a loss because something that we didn't touch on specifically is that when you're doing donor sperm, we ended up doing anonymous donor sperm. That's all paid out of pocket. There is no insurance coverage. So the amount that took was basically, for us, it was our savings, and we were willing to do it because we wanted to, but it's a large amount of money. It's not just something small. So it's hard when that doesn't work, because then you think like, oh, I want that money back so I can try again, and you don't have it anymore. So that's also another loss that happens in the same event. And then anytime there's I will speak specifically for IVF, when you find out the way IVF works, when eggs are taken, basically whatever number you start with will dwindle. And your hope is you get to the blastocyst, is what's called, a certain stage. If you're doing IVF with sperm, by the way, this isn't just freezing eggs, I don't know a lot about, and I'm not speaking to that. There's a certain step you have to get to, and every step you actually lose eggs and an embryo. So kind of going through that was also just it was like you're losing babies every time. And again, this is not specific to the LGBTQ plus community. It's really more to do with IVF process. Another place that is kind of unique, and I don't really necessarily think about, is that if you, in my situation, when we did do genetic testing on our embryos, which is completely your choice and voluntary, and that's not, or at least we don't have any insurance coverage for that. There actually was a limit to like what they will implant too. So that almost felt like we tried to make the right choice, but then it was like, but now you don't have more chances because you couldn't plant multiple at a time. Now it's no, we know these are normal, you only do one, which I know sounds kind of strange, and I hear it and it does seem weird, but in the moment, that's a really hard loss too, because it's like, oh, we were trying to make the best decision for us, but now we can't do as much as we would have liked.
Yeah, and I'll too kind of bring up something else in terms of that's really kind of frames, all of these different kinds of losses, I think, throughout the journey. Every time you have a failed IUI, every time IVF doesn't work, whatever it is. I mean, I think that, for folks within the LGBTQ community, and particularly, I mean, I think that, I'm in my 40s, I grew up, within not as, my parents are wonderful. They're very supportive of me and my wife. But, society in general hasn't always been as supportive of the LGBTQ community. I think that that's changing now, but I feel like in some respects, thinking about, wanting to grow up, wanting to have a family, wanting to get married, kind of having these hopes for the future. And, we had to be given the right to be married, not that long ago, so there are a lot of things that make you feel othered within society. And so when you do want to build a family, it kind of puts you within, really kind of I'm going to use the word normal, which isn't a great word, but, in kind of this, a lot of people, particularly when they're younger, you think about, you grow up, you're going to have a family. You don't think about, oh, as a gay individual, when I grow up, it's going to take me a lot to actually have children. I mean, I have my family, my wife, but to actually expand that family, it's actually going to be really difficult for me. Or some people, it's easier for some people, it's not. In my case, it's been quite difficult. But I feel like, every time you have a failed IUI, you have, something with IVF, from the losses that Shelley was explaining, there's a little bit of like a loss of like your hope for the future too. And like your hope of like just being accepted within society as a family, as an LGBT, as this family, just like every other family, I think that for me, and that may not be true for everybody, but for me, I come from a very close family, and I love my nieces. They're really excited for us to have children, so having all of that, every time you don't have a success, it feels like, it's just, when is it going to happen? There's like yet another blow, to feeling a little bit othered in the situation, and none of my family, none of my friends, I mean, we don't feel othered by them at all. It's just kind of a thing I think that happens being someone that's, a little bit older within the community. We grew up in not as accepting of a time. So for me, that was also part of it as well. And, that also may be something that certainly happens with heterosexual couples in terms of, oh, you grow up, you have a kid, so that also to me is a loss, that kind of loss of your idea of what the future is going to be, or the loss of hope. I think it sometimes maybe hits hard in this situation where you are trying to just be accepted within society and live just like everybody else does. Yeah.
Great point.
And
Yeah, I agree.
And then I wanted to add, oh, go ahead.
I was going to say one thing too, just in terms of thinking about the loss and who it affects. Many times, obviously, we're maybe using donor sperm, donor eggs, whatever it happens to be. That other person too, as well. So our donor happens to be my best friend, and he was always been very supportive and excited about being kind of the favorite uncle type of thing, and he has a wife and a child himself, and everyone's very happy about this kind of coming together of our families. So the losses, for these years we've been doing this, were hard for them too, and then particularly with the death of our son, it was very hard for him as well during that. Sad for me certainly, and my wife, but then also part of him was very sad just for that kind of biological part of him and that child, I think too. So that's something I think that is certainly there are heterosexual couples that have the same situations that use donor, but that's pretty consistent for the LGBTQ plus community. You're going to have that situation. So
like the more people are impacted than we're naturally thinking of.
Yeah.
Okay, I want to finish talking a little bit more in depth about the financial piece. Okay, so you both have brought it up, but let's talk about like the reality of like insurance, the cost, every little thing cost. I mean, like, yeah, just like share with us.
Yeah,
Wait, Amy, you shook your head, and I think that explains it all. It's like,
yeah. I mean, thinking about just, fertility in general and everything that goes along with it, everything that you're supposed to do along with it. So there's not only the costs of the sperm. I mean, in my case, it was known donor sperm, but he's not here. I'm in Los Angeles. He's not here. We had to go through a sperm bank regardless. So you're still paying all those fees. That's just number one. And also, of course, the cost of the doctors and all of the any IUI, every time you do it, it's, I mean, I don't know, $1,000, every time, if, and maybe even more. But also there's all the extra costs too, all of the, my wife went to fertility acupuncture for a long time, taking particular herbs, I mean, all that stuff, and the longer you do it and the more you do that, it just really builds up and up and up. And I mean, I wouldn't hesitate to say that I don't even want to know how much we spent over the last 5 years, and then the IVF itself, we end up finally doing IVF, and that's expensive, and everything was out of pocket. I mean, I can't imagine it would be less than $70,000 or $80,000 easily over 5 years, and that's a lot of money. That's a lot of money. It's kind of but we're willing to do it, but that's a significant amount. I remember reading an article one time, and I think it was in the New York Times, and they were talking, they kind of profiled, I think they were talking about the costs of this. They profiled, I think, 4 different people or something. And they were talking about the costs of that. None of them were same-sex couples. They were all heterosexual couples, but they were talking about the costs of having IVF and different people's experience. And it was greatly varied depending upon where you live. I have a friend, and her husband went through IVF twice or 3 times, and they're in Maryland, and it was fully covered. Everything was fully covered for them, and my experience was vastly different. Nothing is covered. But I remember looking at that, and it was like, oh, this person paid $3,000. This person paid, 10, this person paid 20, and it was just like, that's nuts, having this wide range, just because of the variation between state regulations in terms of covering fertility treatments. But while you're able to kind of take sometimes off your taxes or whatever on the back end, that certainly doesn't keep that money in your pocket. And when it ends with a loss, it's hard to think about that, for sure. It's really hard to think about, wow, what was that all for,
And then I remember you also talking about just in our conversations about like, well, when you've tried IUI, and it doesn't work, how much money you've already spent on that. Should we, you know, should have we just started with IVF and like the money that we use towards that be applied towards that? And
yeah,
not knowing.
I've thought about that a lot. The number of IUIs that we did, we did a year of IUIs every month, and you know, it didn't work. So, and we were trying to mimic what they said. Shelley, you brought up that it takes a year or whatever. So we're like, all right, well, if it takes a year, then you do it every month, you know, during ovulation. So we've thought about that, but it's like, oh, well, and the doctors, oh, don't worry, like there's nothing, it's going to work. It's going to work. Like, don't worry. Like, you know, there's absolutely nothing wrong. There's no reason, you know, everything's fine. So then it's like the doctors are also telling, oh, it's fine, you know, and we had great doctors, but yeah, then it's like, well, shoot, should we have just done IVF, you know, 3 years ago? But, you know, we didn't have the money at that time to pay this large chunk of money for IVF, you know. So that's, you know, also in Shelley, to your point, you know, in terms of, you said, you know, oh, it was your savings and you're happy to do it, but, and with your wife, you know, there was a limit of how much you could do because of, you know, and so that's also a very big reality of in the LGBTQ plus community of family building is, you know, when you're actually able to do this, and if you are able to pay out of pocket, if you're willing to pay out of pocket.
Yeah. Yeah, I was going to speak very briefly just on the insurance end, is that every insurance is so different. My wife and I had very different experiences with our insurance, and I have not tallied it. I have the amounts, but I haven't tallied it because honestly, right now, I don't want to know. And because it's not covered fully. I mean, we've paid a lot out of pocket that is not covered, but every insurance, at least in our experience in Maryland, we work different places and so have different insurances. And that's also very different because there's a weird penalty, like 2 different insurances. You have to go through them completely separately. They don't work together, even if you're a married couple, you know, which is another story. But again, this could be another webinar as well.
Well, okay, thank you both. I mean, there's so much to say. We could keep going and going. I would like to just, first of all, thank Amy and Shelley for being here and being so vulnerable and just talking about this stuff that's not being talked about. So thank you both. And then go ahead, Shelley, sorry.
No, I was going to say, of course, I just was going to say in there, this is where Amy and my passion come from to have this group. I know there was a comment made about it'd be really comfortable to be in a group to talk about this really openly. And my journey has been slower in terms of like wanting to be more open and talk about this. And I really think it's a beautiful thing to be somewhere that would be open in a safe space. And so that's definitely Amy and my goal. So please keep it in mind through Return to Zero. So that's why we feel so much about this.
Yeah.
So I just want to open it up to questions now. You can use the chat feature, and if you have questions for Amy or Shelley, put it in there. I mean, I'm sure that there's so much more to talk about, but and we do hope to have another webinar that dives a little bit deeper into like kind of the grieving aspect of it a little bit, non-gestational parent, the differences in the grieving between the parents, like that type of stuff. But today we wanted to focus a little bit more on the fertility journey part of it. So I'm going to read. So someone just said, I'll read to you. Sometimes that positivity of don't worry, it's fine, you know, after one loss after another ends up feeling not so nice and positive. It's just financial loss and baby loss and just so many losses.
Yeah. Yeah. Oh, don't worry. Oh, just try again. Oh, it's going to happen. It's like, if people feel like they're being positive, I think, but yeah, it doesn't, you're right. It doesn't feel positive. It doesn't really help.
Yeah. No, it definitely feels belittling. And I think that comment definitely identifies that. It feels like it's being ignored that there was a loss. Let's just now talk about what we can do next.
Mm-hmm.
Yeah. And so, hi, Vicky. It's good to see you here. Vicky's in New Zealand also. And so she's just asking about the group. So we're gonna try to run the group in January. And it was gonna be, or no, maybe not no, you're not, you can't do January. Okay, well, we're gonna do it. I'm not sure when.
I think we were talking like spring, maybe early
Okay,
spring.
okay.
Maybe. We'll see.
But it'll probably be on a weeknight, like a this time. So like a 4:30 Pacific, 7:30 Eastern, and then this would be like whatever midday in New Zealand. Okay, another Vicky is asking, do you find a difference in your group between same-sex female-bodied couples and same-sex male-bodied couples? Okay, well, we have not run the group yet, so we cannot speak from that, but do either of you have any thoughts on that?
It's something I'd be really curious about and would love to hear experiences. I think, quite frankly, there aren't many places to just have these discussions. And so I think most experiences you don't hear. And so it's a great question that I'm just as curious kind of what people's experiences are. And that's why we wanted to be really clear and in what Amy said in the beginning, just this is our experience and that's what we can speak from. And we're just speaking as bereaved parents in that experience. But yeah, it's a great point.
And as we're waiting for more questions, I do want to let you all know that on the website, we have a section for parents in the LGBTQ community, like specific information for them and resources. Okay, so we have a section there in the parent section. And then we also have on the providers page, we have a section as well, which I'm going to go through. I'm just going to make sure that it talks about the language on forms and stuff, which seemed to be a big topic of discussion today. And I'll share those in the email that I send out as well. But just trying to build a place where we're talking about this, like in written form. The webinars will be put on those pages as well, as we grow this. Does anyone else have any other questions? Is there a community doula for the LGBTQ plus community?
I think that's a good question. I feel like it probably depends upon where you are. So I'm in Los Angeles, and we definitely know of doulas that are themselves from the community, and they don't. It's not that they only work within the community, but they themselves, have children and are in the community. So I think it just really depends, and that's, I think, another interesting thing to think about in terms of access, which we talked about a little bit. We're fortunate that we both live in big cities where there are options. But actually, previous to this, even though I'm near to LA, I lived in a smaller area a number of years ago, and there was like one doctor, who, like, I don't think he'd ever seen a gay person in his life. So, that's a reality. I think for a lot of people that aren't near to big cities, that you may have a hard time finding access to exactly the type of journey you're looking for. And if you do get pregnant, the kind of birth that you would want, I think, is something that you would be kind of limited access in some areas, certainly.
Yeah, and even just to kind of look back at the financial piece, I know for me, that's also another piece of like, do we even have the money? Sure, I'd love to have a doula. Do we have the money for it? Not anymore. So that is, so in terms of access, not even location, but financial access becomes more limited depending where you are financially.
Where are you, Kaylee? How are we networking parents with support providers? What does that exactly mean? Like after the loss, or? I'm just reading the question. I'm sorry you can't talk. You have to type. So you know what I'm going to do? I'm going to stop the recording right now because I think we're finished. I'm going to say thank you for coming. Amy and Shelley, thank you again for sharing and being vulnerable. This is such an important topic, and I know that I'm excited that we can talk about more in the future, and we can hold a group and have resources and just try to build this out and kind of shine a light on it and bring it out of the silence. So thank you. And thank you all for being here, for watching.